Hello, Mr. Jones. My name is Jessica. I'll be your nurse today. I'll be taking care of you today. So can you please tell me your name and date of birth? Thank you. Just going to check your wristband to see your name and if you're a fall risk or allergy risk. Just check that. Alrighty, thank you. Can you tell me where you are? Alrighty, thank you. So now I'm just going to give you a good head-to-toe assessment, and I'll get that done for you. Then now I'm going to wash my hands and put on some gloves. Alrighty. Alrighty. So first, on my head-to-toe assessment, I'm going to check his hair and scalp for any lesions, dryness, or tenderness, and check to see if he's balding or if it's uneven. And then I will move on to his eyes and check for any maybe redness of the eye. And then I will use my light to shine it in his eye really quick to see if his pupil reacts to the light as it should. So I'm done with that, and then I will move on to his nose and check for any dryness and then I'll move on to his mouth and check his lips to see if it's dry and if he's missing any teeth or have any. You can see if he has anything in his throat just by looking at his mouth. So the mouth could tell you a lot about a person's health. So then I will move on into his neck and check for any swollen lymph nodes maybe or limited range of motion. So he looks really good. And I'll check his ears for any drainage. So once I'm done with that, I will move down and listen to his heart sounds, starting at the apical, and then listen right here, and then listen right here. I'm listening for irregular heartbeats or any murmurs, anything like that that could indicate heart problems or anything like that.
Do we even need this arm?
And then down right here.
Oh no, I just left it there. So we can probably put this up eventually. I can go get it right now. It's not hurting.
And if he's able to, I will have him sit up for me so I can listen to his respiration sounds from his back, listening for crackles or wheezing, which could indicate fluid and stuff like that. So once I'm done with that, then I can move down to his arms and then check for his capillary refill, which indicates his oxygenation. If it's less than 3 seconds, he has good oxygenation. And then do the skin turgor for any tinting, which could indicate dehydration. I believe so. And then I will check to see, push on his arm for resistance and have him grip my hand to see if he could have good nerves. And I repeat the same stuff on his other arm. Then I will listen to his bowel sounds, all 4 quadrants for at least 1 minute. Listening to see if it's active or hypoactive.
It's the battery pack that goes in here that I have never used, but it wouldn't let it work. We had to slip it out. It was being a Monday.
Alright.
Bless you. Bless you.
So if I don't hear anything for after a minute, I will keep listening for at least 5 minutes and then chart whatever I think. Then I will move down to his legs and check for any, as I'm doing this whole assessment, I will be looking at his skin overall for any wounds or bruises and to see if his skin is dry and for stuff like that. So for his legs, I'll be looking for edema and maybe like if I see like vein problems or something like that, just check his legs out. And then I'll move down to his feet and do the capillary refill on his feet, on his toes. So I can see if he has good oxygenation going down into his feet. And then I'll do that. And then I would feel for his pedal pulse, because the pedal pulse is an indication of good oxygenation if you can feel a pedal pulse. So I'll feel for that and have him push on my hand for good range of motion. And then and then once done with that, I will already have taken his vital signs, which is very important in the head to toe assessment, and ask him if he's in any pain, and then we'll proceed from there.